Past the top of the hour, let's get started. Good afternoon, everyone, or if you're dialing in from the West Coast, good morning. My name is Andy Larson, and I'm one of the field vice presidents here with Allstate Health Solutions. And on behalf of your various sales leaders across the country here at Allstate, I'd like to welcome you to today's webinar, where we will showcase the joining of two industry forces, Allstate Health Solutions and our All Things Individual platform of value-based solutions that help your client the most at the time of claim, and HealthSherpa, the industry's leading enrollment platform for ACA. We've partnered together to provide you, our agent partner, a one-stop solution to provide your clients the best coverage possible this upcoming open enrollment period and beyond, while providing your client the best coverage possible. Generates a client that is more satisfied, creates a stickier block of business, generates you more revenue, all the while you become a better agent, no matter where you're at in your journey as a health insurance agent. So before we get started, though, just a couple quick things. We are recording this. We'll send this out post-presentation. We also have representatives from both Allstate and HealthSherpa on the line to help answer questions on the Q&A panel as we go along. We'll get our best to do our best to get to every question here today. We do have a large crowd, so we'll do our best to knock off all the questions as possible here as we go along over the next 25 to 35 minutes. Also, we'll be doing a live demonstration of what this all means. So if you're familiar with Allstate Health Solutions, you're familiar with HealthSherpa, showing you those connection points of how this is all going to be integrated, as HealthSherpa is integrated onto the Allstate Health Solutions quoting and enrollment platform. And it's as timely as enrollment is right around the corner, and we're T-minus less than 2 months. And each year in enrollment, our job as advisors is about connecting the dots for our clients and finding them the perfect fit, the perfect coverage solution, the most comprehensive plan. Now, that sounds great on paper, right? It all sounds good as we talk about it. But at the end of the day, there's some challenges that we face when it comes to finding the perfect plan. Number one, what does comprehensive mean? It might mean something different for everybody. What are those solutions that are going to make a plan comprehensive? Secondly, it could be balancing that comprehensiveness against affordability. And lastly, your time. You know, over the years, we talk, every year we have, it seems, as a finite amount of time in the open enrollment period to meet an infinite amount of clients. And providing that most comprehensive solution can sometimes be challenging, forcing you to go to many different platforms to put all the pieces together. And what happens by and large, though, is you're finding the best possible ACA solution in that given market. But the reality is that best ACA solution in that market tends to come with a $9,000 hole. And that's in the form of the out-of-pocket exposure. And over the years, we've seen out-of-pocket exposure go up. Next year, it seems to be going down slightly, but it's still pretty dang high. And when our clients have to utilize our health, the health plans that we spend that finite amount of time consulting them on, they're faced with holding the bag on a high out-of-pocket expense. In addition, network limitations or limitations on experimental treatments can cause your clients to hold the bag of having to pay additional thousands of out-of-pocket should that diagnosis be a little more complex. They might need experimental treatment. Maybe they need to go to a center of excellence. There's many reasons why an ACA plan might have a gap into it, aside from what the minimum essential coverages will provide. But what if I told you we could simplify all of that in a world where the partnership where Allstate Health Solutions meets HealthSherpa, HealthSherpa integrating a white label version of their platform into the Allstate Health Solutions platform that you all know and love, where you can go in and create a customized, comprehensive solution. So when your client has to use their health plan, you have solutions in place that are going to bubble wrap them from what those instances might be. And when they have to use their plan, they're not going to fall off the cliff and go into a financial abyss because of that. So today, we're joining forces with HealthSherpa. We're going to show you what it's all about. First, we have Allstate Health Solutions, all things individual, solutions that are designed to tailor your client's coverage, provide your clients real value and coverage that protects them when they need it the most. That exudes confidence in the solutions that you're providing for your clients. Then there's HealthSherpa, again, the tech-driven platform, the industry leader at ACA enrollments, providing you simplification. Not only does it streamline quoting, but also enrollments, renewals, keeps all your clients' data in one spot, so on and so forth. Now, if you're familiar with Allstate Health Solutions and you're familiar with HealthSherpa, we're going to go through this, the familiarity points. You're familiar with both. We're going to keep it familiar as we go along and show you what those connection points between Allstate and HealthSherpa are. But if you're familiar with Allstate Health Solutions, you're familiar with the quoting process, we're going to introduce you or connect you to HealthSherpa so that way you can serve your ACA clients and provide them that customized solution. Now, it's important to note a couple things. One, Allstate Health Solutions is not the holder of the ACA contract. So if you are looking for an ACA contract, consult your upline or wherever the carrier is that you are going to be utilizing in your market. This is simply a concept to connect you with all the carriers in a market to be able to provide that customized solution with the Allstate options of products behind it. Secondly, we are still in the process of the approvals through CMS. I can tell you right now, we just got our first response, and we're looking at about 5 or 6 small items that need to be cleared up by September 17th to get that final review and stamp of approval. Well, we are looking at this being available to our agents and our partners on or around October 1st, give or take. Hopefully plenty of time to get you up to speed on this solution well before open enrollment, and that way you're set ready to go and give your clients that best look for their coverage in 2025. Now, this concept is going to be available in the FFM states only, so the federally facilitated marketplace states, no state-based exchanges. So if you're from Minnesota or California or Pennsylvania, if you fly the borders to states around you, you'll be able to utilize this concept or this service in those state-based exchanges, or excuse me, federal FFM state exchanges. Hybrid states like Georgia, for example, that we're including that in this concept as well. So therefore, keep in mind, federally facilitated marketplace states only. Now, before we jump into the demo here, you might be saying, okay, well, what does a customized solution look like? What does comprehensive coverage look like? So let's offer you a suggested serving. And in this case, we're looking at a 40-year-old male in Texas that earns $50,000 a year, earns $147 a month subsidy. So in the customized package, the comprehensive package, it all starts with that core health plan, which is ACA. And in the Allstate Health Solutions platform, you will find all of the carriers that are available in that given market, available through the HealthSherpa platform. In this case, we have the Blue Cross Blue Shield expanded bronze plans in Texas, $7,400 individual out-of-pocket, $185.50 is that estimated price after the subsidy has been calculated on the Allstate Health Solutions platform. That $185.50 goes to Blue Cross or Blue Shield in Texas, as your clients would normally pay their ACA premiums. Now, to take this into the realm of customization and personalizing and providing that better package, we're going to add in some other benefits that include, for example, dental, which is the most widely used health plan after the widely used plan after the core health plan. And we're going to bubble wrap that $7,400 out of pocket with a product called the Plan Enhancer, which in this case a $7,500 benefit to protect your client in the event they have an unforeseen accident against that high out-of-pocket exposure. And lastly, in this package, we've also included a $30,000 lump sum benefit to pay for first ever cancer diagnosis, and then pay a $30,000 lump sum benefit again for first ever heart attack or stroke event. So with this package of products, not only does your client offset their out-of-pocket in the event of an accident or the big three, cancer, heart attack, stroke, now they can go get their teeth cleaned as well with a fantastic dental plan through Allstate Health Solutions. And the total monthly that would go to Allstate Health Solutions is $100.54. But as we consult our clients and we do their needs analysis and look and say, what are the things that keep you up at night? What would happen if you were to have a claim and you had a $9,000 out of pocket? would that be impactful to your bottom line? The answer to that is yes. Here is our budget, Mr. and Miss Client. We just, for this total package, we told you where the premium for your ACA plan is going, where the premium for Allstate is going. Your total health insurance solution is going to be $286.04 total, keeping you well under that original price prior to subsidy. And now we've not only provided you that major medical coverage, but now we've bubble wrapped that out-of-pocket exposure. So when you need it most at the time of claim, you're going to be financially protected. So next, we're going to go into a live demo, and I'd like to introduce Amber also from HealthSherpa. She's going to be joining us as well with this. So as we set this demo up, it's important to note that each agent that is contracted with Allstate is going to receive a credential here in the near future. And that credential is going to show an Allstate type of email address, where at that point, when you log in for the first time, you'll need to create a new password. But this screen here is the login for the HealthSherpa white label specific to Allstate Health Solutions. If you already use HealthSherpa today, to utilize this feature, you will have to utilize the white label version. You can upload your existing business from the HealthSherpa that you use today into this white label. And as you log in, you will find that the password here, Kevin, if you're online, help me out here. We will find that the HealthSherpa is going to be similar as what you normally would do. Kevin, I want you to help me out here with some credentials.
Yeah, so this step no one will ever see, right? This is just to get into the staging environment. So Andy, for this one, I'll post what you need to put in this little drop down here into the chat.
Thank you.
Grabbing it now.
All right, as we go through this here, we'll get the credentials in. But as Kevin mentioned, as we go through this, though, while we get these credentials put in, when you start your day, you'll log into the white label version of Allstate Health of the Allstate HealthSherpa account. And when you log into that account in the background, then you will open up your Allstate Health Solutions platform, and then have that going as your main source of quoting and enrollment.
Right. So logging into the HealthSherpa white label of, Allstate HealthSherpa combined white label site, all it's really going to do, you just need to leave it sit open behind the scenes. All it's really going to do is facilitate the sign on behind and apply. So once you move into the enrollment experience off of any shopping cart, having this open behind the scenes just saves you time later when you come in and look at your dashboard and look at all your content on the HealthSherpa side for the ACA product. And Amber will get into that more shortly. So
For sure.
Okay, go ahead, Andy. You're in.
All right, so now we're in, and so if for those of you that are used to using HealthSherpa, it probably looks and smells the same as you normally would. The only difference here is you see the Allstate logo in the upper right-hand corner. As Kevin mentioned, this is going to run in the background. Now, the other screen that you'll open now is what you're familiar with, as you've worked with Allstate Health Solutions throughout the years, and that's the quoting and enrollment platform. And in this case, we're going to start just like we normally would. Effective date. Put in our zip code. Date of birth. Gender. So everything up to this point is familiar to you as a partner of Allstate Health Solutions that has been in our system. So everything looks the same. You have all your product options on the left-hand side. You can edit your client's information. Where we're going to want to go next is Health on Exchange. Now, when you land on Health on Exchange, there's going to be a question here that relates to consent. There'll be more consent features that will be in HealthSherpa that Amber will go over as we go through this. But then we just go through tobacco, household size, just like normal. And then we are going to enter in our client's income. Specify the enrollment date. In this case, we quoted for an October 1st. Now we show all plans. So as we see here, as we land on this, we have our household size and our household income. We have our estimated monthly subsidy and our cost share reduction up to. So in this case, $40,000 gets $198 a month estimated subsidy. In this market, which is Arizona, shows 109 plans. And as you look at the filters, we'll go through this real quick. The filters will let you know or filter by the carriers that you utilize. So if you utilize United Healthcare or Cigna, you can filter out those carriers. If you're looking at bronze or silver plans or looking for the cost share reduction, you can navigate these filters to get to where you need to be. Or if you're looking for a specific network type, or if you wanted to filter it by, your client's premium dollars are going to be right around $250. That's their health insurance spend. And we're trying to maximize that spend. We look at perhaps a little bit less than that so we can factor in a customized solution. So hiding those filters, we're going to, just for sake of example, we're going to look at this bronze plan with United Healthcare, $103.23. Add that to the cart like we normally would any other Allstate Health Solutions product. Now, down below, you're going to see some discounts that might be available to your cart if you are shopping for the supplemental plans. So in this case, we want to customize this a little bit. We're going to look at, because it's an ACA client, we're going to go with a guaranteed issue solution. So we're going to take into account the plan enhancer, which is an accident medical expense plan. We'll take a look at subsidizing about 3/4 of that out of pocket. And in this case, then we will put in, take a look at the cancer, heart attack, stroke plan. And then maybe we'll look at a dental plan. Now with the dental plans, we can save up to 15% when bundled with other Allstate Health Solutions products. So in this case, the client just wants to have their teeth cleaned. They're maybe not concerned about any other element of major services. We're going to skip the vision portion of this, add that to the cart. Now we have a combined shopping cart of $167.79. $103 of this will go to United Healthcare once that premium is met. And the package for Allstate Health Solutions is $64.56. So even for those that qualify for a $0 premium because of their subsidy, they're likely coming to this meeting to pay something. So even if they are a full subsidy client, don't have preconceived notions that these solutions aren't available for them. Miss 100% of the shots you don't take. So we encourage you that for every single ACA enrollment that you have, utilize this white label so that way you can provide this customized solution. Your clients know these products exist, and then you are checking your boxes as a trusted advisor and being a better agent in the process. Whether or not they buy, that's at least you've done your job in checking those boxes. But in this case, $167.79, well within the client's means of their health insurance spend. We've packed in the accident plan, cancer, heart, stroke, and dental. We've got a nice little dental discount on the dental plan. So now it's time to apply. So once we click apply, now we're going to put in the client's first name, last name, and this is where we will begin to connect with HealthSherpa. So we are actually leaving the Allstate site and returning to HealthSherpa to pick up where you would normally leave off on an ACA enrollment. And at this point, I'm going to hand this over to Amber, and she's going to drive the bus on the HealthSherpa side to show you the highlights of what is familiar for you agents that are in this site already, what might be new this year, and for agents that are new to HealthSherpa, what you can expect in this site and what are some of the features and what a simplified enrollment might look like. So with that, Amber, take it away.
Hey, awesome. Okay, great. Well, thank you so much for the great presentation so far. So I will hope to live up to everything you've laid out for us already. So we're going to go ahead and start our application. And so the cool thing about this is the platform is going to prompt you to do certain things along the way to kind of help jog your memory. So for example, when we start our application, we can go ahead and key in a first name and a last name. And we all know, right, as licensed agents, that you have to have consent from the consumer to even search the marketplace on their behalf. So one of the cool things that the platform is going to do for you is go ahead and include a little checkbox here It says, hey, you have their permission, right, to click this next button. Are you good with this? If you don't have their consent by this stage, let the platform do the heavy lifting for you and reminding you, hey, let's take a pause and make sure you're good to go. So we're going to go ahead and say we do have their consent, and we're going to search the marketplace on their behalf. Now, shockingly, this consumer does not exist, right? If they do exist, you can go ahead and grab an existing marketplace application to go ahead and get that application updated and help them with their updated plan selection. Today, we're going to go ahead and create a new application. We're going to assume this person is brand new to the FFM. So we're going to have some pretty standard privacy statements here. We're going to read through these, and our consumer has decided to agree, so we'll check these boxes. Now, focusing back on consent, right? There's really those two types of consent. There's this initial consumer consent where they say, yep, you can use my personally identifiable information to give me a quote. You can search the marketplace on my behalf. I'm giving you my initial consent, right? You have the ability to actually capture this here within the platform. So let's say you want to email a digital consent form to your consumer. What's cool about this one is timestamps will be included, and it'll automatically be stored for you on the platform. You know, you have to store it for, 10 years? So you can let us do that heavy lifting for you. The next little bubble there, the text consent, it's not live yet, but we do hope to have it live soon. So you're welcome to use that once it's live. Let's say maybe you already have consent documented somewhere. You want to just upload it to HealthSherpa and let us store it for you. You can do that. Today, we're going to select the last bubble and just say, you know what, I've already got it my own consent record stored my own way. I'm good to go. So now we're to our primary contact information. So we'll start keying in the gender. And then we also notice that there is a little checkbox that says, I don't have a social. Now, we all know, though, social is not an optional field, right? If a consumer has a social, they have to provide their social on their application. There's really no workaround around that. But today we say, you know what, I'm helping a consumer that genuinely doesn't have a social. So we're going to go ahead and check that box. For our address, we can go ahead and start keying that in. They're in Phoenix, Arizona. I think that zip might be for Phoenix. And what's cool about this too is if our zip code is over multiple counties, we'll see that listed there in the drop-down menu. And if we have a different mailing address, we can go ahead and key that in. Today, we'll say those are the same and hit continue. So email address, let's talk about that one. You always want to include as much information on a consumer's application as they are willing to provide, but it is technically an optional field. So if they don't want to provide their email address, they don't have to. Phone number is not an optional field. So let's go ahead and do a phone. You've got several different types of phones. So you've got, homework, cell, etc. What else is cool about the platform is throughout the application, you'll see these little question marks with the circle around them. You see them kind of by written and spoken language. And you see these, if you click on those, you'll get a little tooltip. That's really nice if your consumer's asking you questions about why they're being asked this. So hopefully this takes the pressure off of you to start cobbling a bunch of new words together, right? You can hopefully just lean on the platform anytime you'd like. Okay, we're going to say we'd like to get notices about our application in the mail. Continue. We're going to sync up with the marketplace. So once you get to the household section, I'd like to show you a couple of things here. So let's say John Doe is not actually applying for coverage. John Doe is actually applying for a child that they claim on their taxes. So this is actually going to be a child-only application. If I select no here, and then down below where it says who else is applying for coverage, if I select add another person, you can call them kiddo one, who, whatever you'd like to say here. And we'll need a birthday. Check out this relationship to you category. It's not only super long, but the last two categories are other relative and other unrelated. So you can truly care for 100% of these complex tax household circumstances when your consumer is sharing that they have them. So let's just click on one of these for today. So you can see what that looks like. Sure, save, yeah. There you go. A safe person. So if I were doing a child-only application, scroll up just a shade. This is what it would look like. So I've started the application correctly. John Doe's not applying for coverage, but we are using John Doe's tax household information to get Kiddo 1's subsidy eligibility processed. So today we're going to take the happy path. So we're going to remove Kiddo Doe and go ahead and say that John Doe is applying for coverage. The other cool thing is if you don't want to proceed with subsidy eligibility inquiries, right? Let's say your consumer knows they're ineligible for subsidy dollars, or maybe they think they're eligible, but they don't want the dollars. They can select no to this next question. Do you want to see if you're eligible? So if they just want to shop for on-marketplace plans, but they don't want to proceed with subsidy eligibility, this is how you would handle that. So again, today we'll take the happy path. We'll say yes, and then hit continue. Okay, we're going to say no, we're not married. And yes, we plan to file taxes. We don't claim any dependents. If we said yes to that question, it would say, great, is it Kiddo Doe that you just told me about, or is it a different dependent? So you wouldn't have to rekey all that information. Okay, we're not going to be claimed as a dependent. And then we'll hit continue. So we don't live with anyone under the age of 19. Now, this is the cool part of the social field on this page. Again, we know social is not optional. So if at this point my consumer says, I don't have a social, let's go ahead and check that box. The platform is going to help you educate your consumer if you haven't already had a chance to do so. Okay, consumer, if you truly are ready, we can attest that you don't have a social. You've never been issued a social. Awesome. You're going to have some homework, right? You're going to have to prove your eligibility to enroll in this ACA coverage. You have to prove your income. The whole purpose of this marketplace application is to submit the eligibility application, and then that data goes back and tries to marry up to what the IRS.gov has on file, right? With social, that's going to be hard unless they have alternative documentation that can prove all this stuff, which they are absolutely welcome to use. Okay, so we're going to say we've not used tobacco, and we are a US citizen. You'll notice though you've got tooltips along the way here if you ever need them, if these are sticky questions for people to answer. We're not incarcerated. We're not American Indians or Alaska Natives. Remember though, this one has a direct impact on subsidy eligibility and special enrollment periods that are available. So just like you do for all questions on the app, you really want to make sure to answer these appropriately. And all of these remaining questions, all related to race, ethnicity, sexual assignment, gender identity, and sexual orientation, the SOGI questions, as it were, they all have iterations of decline to answer options available. So if your consumer doesn't feel comfortable answering these, that's okay. CMS is trying, though, to really focus on health equity. So you certainly never want to guess the answers to any of these, right? But if you ever feel comfortable, ask your consumer, do you want to provide the details to this and include that data if they'd like? You'll see some of these down below are optional. So we'll just hit continue. Okay, we're not a naturalized or derived citizen. If I'm not sure what that means, I have a tooltip there. Real quick call out too, sorry, on the last page, you don't have to go back, but there was a moment where it almost looked like it's duplicating my customer on the left-hand side under members. It's actually just a second page of questions. So if you ever see that, don't worry. It's really just bringing you to the next set of questions. So what's cool about this next portion, the income information, is, I don't know about y'all, but it's really hard to remember all the different types of income to report. What are you supposed to exclude? What about all these kind of one-off situations? How do I care for these kind of nuanced things that are going on with my consumer's income? A lot of times you have to go kind of hunting and fishing for all of those separate lists. We try and just put the list in the platform where it becomes applicable. So right here, you'll see you've got the list of all types of income to include, types to exclude. And then as you scroll, you get a lot of these kind of one-off situations. So hopefully this helps you and kind of keeps everything all in one place for you. So today we're going to say John Doe does get income. Now, there's a lot of different types of income, right? I mean, this is a long drop-down menu. There's even an other category. We all know that's my favorite. But at the very top, we're going to say today, job. And we'll go ahead and key in our employer's name and phone number. The other cool thing though here is, let's say that my consumer doesn't get an annual salary. How often do they get paid? Well, how often they get paid hourly. And, my consumer says, I make 16 bucks an hour. I work 40 hours a week. I don't have to sit here and do the fast math. I can simply key in the data the consumer is giving me. So just keep that in mind. Let us do that heavy lifting for you. Again, we're taking the happy path today, so we'll change that to yearly. I think we went with 40,000 on our quote page. So we'll stick with that. Oh, yep, there you go. And then we'll save this one. And then when this saves, you'll notice you can edit what you've just keyed in. You can remove it. You can add additional sources of income if you'd like. And today we're going to say that that's good. Yep. So we're going to say we don't have deductions. I also have a tooltip under the word deductions. See those little dashes under the word? So if I don't know what that means, I can hover there as well. And then, so yeah, all that looks about right. 40,000 seems like it should be my income. So we'll say yes there. Now, the way these additional questions work, you'll see we're now in the additional questions section. If the answer is yes, you check the box. If the answer is no, or I don't want to talk about it, you see how some of these are optional, you leave the box alone. So we're going to say my consumer says, ugh, I don't even want to talk about extra help. Nope. Okay. All right. No problem. We're going to leave those boxes alone. These next questions here about Medicaid and CHIP, what I think is really helpful about these is they include a dynamic date range. Today is September 4th. So what the platform is doing is it's looking at today's date and it's calculating the customer's possible special enrollment period, right? So if they have their letter in front of them, you can say, hey, do you have a date on that letter that falls between this range? So again, you don't have to do that fast math. You can really help them here. A lot of times CMS has noticed consumers are accidentally reporting, we assume accidentally, right, that they've been denied Medicaid when maybe they haven't yet been denied. So if at this point they think they've been denied, their letter. If they can't get their hands on that, that's okay. Do they remember the date or approximate date? If you check these boxes, you'll get some follow-up questions accordingly. So just keep that in mind. Okay, so we're going to say, yes, we are currently enrolled in coverage. And wouldn't you know it, it is going to end before the 3rd of November. Okay, we don't need any information about health reimbursement arrangements or HRAs. So we're going to leave that box alone. We haven't actually even been offered an HRA. You may also hear these called like ICRAs or QuiSeras. So just to keep that in mind, they're kind of where the employer can offer the employee dollars to put toward their health insurance. So if they've been offered that, the application just needs to care for that. Okay, we're not going to be offered coverage through a job, so we'll leave that alone. So now we're to our, how do we qualify to enroll in coverage right now, right? We know we're outside of the open enrollment period, so we're losing coverage before the 3rd of November. So we'll check that first box, very first box up top. Nope, not yet. There you go. Thank you. Okay, and we're going to say we're losing it on the 2nd of November. Let's see, can we change that month to 11? Yeah, there you go. Perfect. And then down below, you can leave that one. And then down below, during recent changes, especially if there are different, folks on the coverage, you always want to cover all of these questions with a person. If, for example, kiddo 1 was still on this application, maybe they were adopted last month, right? Their effective date could be very different than John Doe's, depending on all the other changes that are going on in the household. So you really want to make sure and cruise through all of these applications for every person on the application. Okay, so again, down below, we have not been offered ICRA or QuiSera. If we have, let's check that box right here, just so you see. You're going to have follow-up questions, and it's going to really dig into the amount that you're being offered. So just keep that in mind, and it'll kind of prompt you to ask the consumer those questions as they go. Okay. This is a new question, the voter registration question that CMS has added to the application this year. So you can select whichever you'd like. Okay, now we're to our little finalize page. If we need to pop into a section, back into a section, I should say, you've got these nice little edit buttons along the way. So those are especially helpful if maybe your consumer says, gosh, I thought of something later. Oh, we should have included, right? We'll hit continue. Okay, you'll have some agreement statements we'll agree to. Yes, we want our eligibility to roll over. I know I've got to file taxes. And if something changes, I've got to tell somebody about it. Be sure to read these to your consumer. Please don't summarize them in the way that we're doing today. Go ahead and hit continue. And of course, we can agree that the marketplace, Medicare, Medicaid, they all talk. If something changes, I got to keep them all in the loop. And because I, as the agent, have acknowledged that I do have consent to work on my consumer's behalf, I can click agree on this last portion and type their name to electronically sign. And then we're going to get our eligibility results. What I think is kind of cool too about this next page for the eligibility results is it gives me a little summary. So it's a nice way to say, okay, it's all going to be in one place. I can go ahead and let the consumer know, congratulations, you qualified for those cost share reduction dollars, right? You're eligible to enroll for a special enrollment period. You're eligible for a tax credit. You are going to have some follow-ups, right? We knew we would because we didn't give the application a social, right? So we're going to download our eligibility letter. And then we will review our plan. Now, what is really important about this page is you see the savings box. I want to imply all of my savings. Our consumer, John Doe, is eligible to receive $198 monthly of their subsidy dollars. Those are advanced premium tax credit dollars. Sometimes consumers are really just doing their best to guesstimate their annual income, and they don't want to be at risk of having to pay some of those dollars back if it turns out that they weren't eligible to receive all of those dollars. So sometimes they don't want to use it all. You can uncheck this box. You can key in whatever number they do want to use monthly. It can be $0, it can be $4, it can be $197. Doesn't matter, they can customize this as they need. So if they don't want to use all the dollars, this is where you would adjust that. Okay. And then lastly, enrollment review. So again, the second step of our consent acknowledgement, it's this enrollment review. They have to be able to see their application, make sure they see those attestations, review which plan you selected for them. So you have the same options here to go ahead and proceed with documenting that consent. It has to be notated that it's two separate events, right? We're going to say today that you already have proof in your own records, but really nice that you can go ahead and let the platform control that for you if you would like to do so. Okay, we're going to enroll in this plan. And then we should get popped right into our dashboard. We'll get a little summary page, and down below, we'll go ahead and cruise into our dashboard. And we'll cover just a few more things here in HealthSherpa, and then I'll give it back to your Allstate team to go ahead and finish up with how you would get your supplemental plans added. So you'll notice now we're in our client's details page. What's really important about this is it's broken into a couple different sections for you. Notably, this first section, follow-ups. Again, we knew we would have them. We knew we had to verify loss of coverage, income, and citizenship because we never gave them a social, right? And also we're applying thanks to a special enrollment period. So the interesting thing though about these follow-ups is because they're all different types of follow-ups, you've got a different kind of pick list of documents that you can use to verify each item. Well, how in the world are you supposed to keep track of all that? So if you went ahead and clicked on one of the verify buttons, what's nice about HealthSherpa is we actually include, you'll see down below once this finishes loading, all of the acceptable documents to verify the specific follow-up item you've selected. So it's really nice that this is going to be a dynamic list. It'll change depending on which follow-up item you select. So you don't have to go hunting and fishing for all those different things. You can simply grab your type of document, select your file, and upload whenever your consumer is ready. So let's just use our back button real quick. The other cool thing that you can do within your client's details page, once this loads again, when you'll scroll down right underneath the follow-up section, you can actually view the application. So if they call you mid-year and they say, gosh, there's a little view or edit button there. If they need to update something in their application, you can do it right from here. You can go ahead and click on that. You'll see a little summary. It kind of looks like our finalized page, right? You can hop right back into the application, make any updates they need and resubmit that. If you close out of this, the other cool thing is you can see their plan down below. So I can actually get into their plan details. I can find the agent of record, right? So if I need to track that, I can do all of that over there. Down below, I've got enrollment history. I can also upload consent right here. So let's say initially I said, oh, I'll store it on my own. And then I thought, you know what? I'm going to let HealthSherpa do that. I can just upload it right here if I'd like. And then down below, I also have some marketplace notices. So if I do need to pop back into my eligibility letter, maybe their documentation that they submit gets rejected for whatever reason, I'll get a little insufficient notice that pops up here. So it's really nice that everything lives all in one place. If you scroll back up to the top, the other thing that I just wanted to call your attention to are these tabs on the left-hand side. So let's click on Home. Home is a really nice starting place if it's been a while since you've logged into your HealthSherpa account, or perhaps you're new to HealthSherpa. You've got a nice little summary of like some notifications that might be new since the last time you logged in. On the right, you see like a news section. So if there's anything new and exciting coming up, your FFM integration, this is actually a new CMS security measure. So anytime you're logging into an EDE entity like HealthSherpa, for example, or if you're just using healthcare.gov directly, you've got to integrate your FFM accounts, and you've got to do it every 12 hours to keep it secure. So you'll have a nice little countdown clock there for you on the right. Maybe you haven't done your 2025 FFM certification yet, and you want to go ahead and do that. So this is a really great starting place. Back on the left-hand side, going back to our tabs, we're going to click on Clients. So here you're actually going to find John Doe, right? The application that we just completed. The clients are the folks that have completed their subsidy app with you and they've selected their plan. So the clients are folks you're going to help effectuate. You've got nice little search fields up here toward the top. You can search by FFM ID, which is really helpful. The other cool thing, especially if you are used to HealthSherpa, maybe you have another account and you want to import all of your clients into your new Allstate account, you'll notice you've got these little import and export buttons on the right. If you click on import, for example, you actually have a help article that walks you through how to do all this, but you also have steps outlined for you right here. So if you ever have questions about this, you can absolutely reach out to agent support and we can help you. And then, and close out of that. And then you also have an export button. So if you do have a different account, you're trying to export those folks over and you want to import them over here, you're welcome to use the export button in your old account as well.
Yeah, that's a great point, Amber. So for those that are utilizing HealthSherpa today and want to utilize this solution to not only utilize Allstate, but HealthSherpa all in one, this is where they would go to export their business from their existing HealthSherpa into the white label. Is that correct?
You're exactly right. Yeah. And if you have any questions or you don't see those buttons on your existing accounts, just reach out to agent support and we can help you each, one at a time. Happy to do that. A couple follow-up things here before I give it back to your Allstate team, the leads tab over there on the left-hand side. So the main difference here, what's the difference between a client and a lead? The leads tab are folks that maybe have started their subsidy app, or maybe they started shopping for a plan, but they haven't actually finalized one or both of those steps. So especially as we cruise into your marketing tab here in just a moment, the leads are super important because you can grow your book of business with very little legwork sometime on your end if you use that marketing tab. So a lot of times you'll pop into your leads tab here and you may see a new name that you don't even know. Great way to start following up with a person. You see their phone numbers listed here. I see over here on the right-hand side, these people are applying for coverage. They're applying for their subsidy. It means when I reach out to them, they may have some questions about that subsidy app, right? I might want to have some resources from irs.gov pulled up. Some people are shopping. Okay, cool. Maybe they have some questions about deductibles and out-of-pocket maximums that I can be ready to help them with. So it's a great way to kind of start organizing your day a bit before you just pick up the phone. On the left-hand side, cruising next over to our marketing tab. So this is a free branded enrollment website. If you click on the branding icon, little mini tab under the G of marketing, up, There you go. You can actually change up the company name and the phone number that's going to display. So it's a really nice way to kind of customize it a bit. And then if you go back into the analytics tools there, the main tab, yeah, you actually have scroll down just a shade, a little bit further. Let's grab that generated marketing campaign URL. Yeah, let's just highlight that, pop it into a new tab. If your consumers click on your marketing link, this is where they land. It's a nice professional link. If they type in their zip code, they can actually view plans and prices. And the second they type in an email or a phone, you get a lead. So a lot of agents like to use this in their auto signature, pop it into your socials. If you have a customer you're helping, say, hey, if you have a neighbor that needs my help, here, give them my link. It's a great way to, again, grow your book of business and just really have a little bit more personalized touch in doing that. So keep that in mind. And then we'll finish up shortly here. I just want to call your attention to the very top of the page on the right-hand side. You've got two icons. If you hear nothing today from the HealthSherpa team, please let this be it. Click on the question mark in the circle. This is the most important thing we can ever teach you from the HealthSherpa side of the house. If you need to reach out to agent support, we are always here to help you. You can email us, you can call us. You see our team is online, you can even chat with us. If I open up the Help Center, go ahead and click on that. It's really just a running list of frequently asked questions. If I just type in the word import, for example, at the top, I get loads of articles that I can view and I can go ahead and get help, right? So if there's anything that we can help you with, just know that we're here to do that. Lastly, back on your dashboard in HealthSherpa, the little gear icon up on the right-hand side. This is, you can change out anything that you need here. You can log out, contact agent support. The carriers menu is there, which is helpful. And then over on the left, if you ever need to update your password or something like that, you can do that within your settings tab. Okay, I think that is everything from the HealthSherpa side of the house. So I will go ahead and pass it back to Andy and Kevin.
Beautiful. Thank you so much, Amber. And I think as we looked at the Allstate side and then how it connects into HealthSherpa, saw the magic, right? And so now that we've done the ACA enrollment and we've made sure that that's set up and everything checks, now the question is, okay, well, now how do I enroll the supplemental plans? And as you may have already surmised by viewing the screen here with Amber, there is a page that says return to Allstate, or that the little button there, it says return to Allstate. So now this will bring you back to the application itself, just as you normally would with an Allstate enrollment. So you'll see the sections of our application on the left-hand side. You'll see the different products that are on the right-hand side and the same questions that you would normally answer with Allstate. Now, the one component here is that just because of CMS rules, the information on the client information will not be imported. We have name, gender, and date of birth just by virtue of what we put in from that perspective at the beginning. So we're just going to take an extra couple seconds and we're going to enter that in again. Check and save that address. So here we go. So now we are updating the shopping cart here. We are in a test environment. Sometimes things don't go as we want them to go. But at the end of the day here, as you can see this highlighted version in the background, you'll see your plan selections here on the right-hand side. You can verify that. And the application is as normal as possible. And the great feature about this is that, yes, it does take you a couple seconds to enter in the banking and the client information in terms of the address and who you're covering. At the end of the day, this extra 2 to 5 minutes can earn you an extra $150 to $500 in commissionable income to you based upon this enrollment. The best part about this, though, is as we get to the end here, under this plan and signing button that you can see kind of grayed out there, is now you have the ability to do a attestation through a text message PIN code. You send your client a text message, they look at their phone, they get a 6-digit PIN code, they read it back to you, that serves as signature. So the ACA process is the ACA process. That's no different whether you go through HealthSherpa or you go through our white label. Now we've taken the two components of that enrollment and we've smushed them together to provide you that one-stop opportunity. So from that perspective, you're simply just understanding what those connection points are, and then you're going to come back to your screen and finish this enrollment, and all your information will be found in the back office, just like it normally would for the Allstate enrollment. Now, as we wrap up here today, by taking advantage of this scenario, a couple of next steps to consider. Number one, any contract agent with Allstate Health Solutions will receive that credentialed login for the HealthSherpa white label. Upon the first login, you will click on that forgot password and then create a new password for you to move forward with as you go forward with the concept. Again, if you're using HealthSherpa already, Amber showed you where you can export your block of business and upload that book of business into the white label. Unfortunately, the two systems don't talk to each other, but that import-export button will allow you to go back to the standard version of HealthSherpa should for some reason 6 months down the road you want to bring everything back. But at the end of the day, you can utilize your white label version just as you would your normal version of HealthSherpa, but now you get access to just pick, click, and go through the Allstate site. And as we approach enrollment here, let's understand our game day process. So as you start your day, you'll log into that HealthSherpa white label account. Let that run in the background on a separate tab, like Kevin alluded to earlier. Then you'll go into your Allstate portal and start customizing and creating comprehensive solutions. Now, it's our recommendation. Again, I said earlier, you miss 100% of the shots you don't make. Our recommendation or our suggestion is that live in that Allstate site, create that comprehensive package after calculating the subsidy, household income, all that information, and move forward with that presentation. Give your client that right of refusal. Check all those boxes. This is what you told me keeps you up at night. This is what your concerns are on that high out-of-pocket. We've created a tailored solution. Even if they decide that they're not going to enroll on the supplemental plans, you still continue on to HealthSherpa and continue that ACA enrollment as normal. No harm, no foul. You're continuing on, but now you've exposed your clients to other solutions that are available. Perhaps 6 months down the road, they'll give you a call. Another pro tip here is to create create customized templates of what those solutions might look like ahead of enrollment. One, you can create a GI package, accident, dental. That will, in most cases, our accident plan will have riders for hospitalization and cancer, heart, stroke that are guaranteed issue as well. That speaks a very good story as it pertains to coupling with an ACA plan that is also guaranteed issue. Or create suggested servings as a matter of a dollar amount. Create a $30 package, a $50 package, a $75 package, or a $100 package. So that way, as you consult your client and ask them questions, probing questions, Mr. and Ms. Client, what's your ability to pay? They'll be able to, you'll be able to take that ability to pay and put as much as you can into that ability to pay and the best solution possible. So as we wrap up, we want everyone on this call today and all of our partners to take advantage of this concept. And by doing so, be on the lookout for some upcoming incentive opportunities in fourth quarter centered around our supplemental plans, our accident, dental, critical illness, our fixed benefit options as well. So that'll be coming down the line. And as you utilize this concept too, and you write our supplemental business, any piece of supplemental business that you write will also qualify toward our top producer conference in March of 2025 in the phenomenal, gorgeous Cabo San Lucas, Mexico destination, staying at a all-inclusive resort. We'd love you and a guest to join us. You must be one of our top 50 agents in total annualized issued premium. And any supplemental sale that you generate, whether it's today or enrollment, anywhere from May 1st to December 31st, will count as 2 times an annualized issued premium to get you to Cabo. So we hope to see you there as well. And then it's important that we also suggest that before enrollment that you get informed. So we're going to be doing this again next week with the HealthSherpa team on September 10th at noon Central. Maybe go a little bit more into the weeds, but outline the concept as well. So if you know anybody that missed today, make sure that they know that there's another session that's available next week. Get informed before open enrollment, so that way when we get that stamp of approval, you're ready to start playing around, getting comfortable with those connection points between Allstate and Sherpa, back to Allstate, so on and so forth. And if you need to get closer to the solutions that we offer here at Allstate Health Solutions to provide your clients that value when they need it the most, connect with your Allstate Health Solutions sales team, one-on-one training, group training if you want to get your office all in together on a call to go over some of these solutions and concepts, or if you have a downline agent block that you want to get all together, maximize the time, their time, your time, our time, get everybody all in one room. We'll be happy to do some more trainings on a one-on-one basis or as a large group as well. And always you can have self-service available to you at allstate.com, where you can find all of our brochures and pitch pages, and then YouTube for various product training tutorials. So with that, we hope that you saw the magic here, that when you join these two forces together, what it can look like. And at the end of the day, it's all about providing a solution. And we're not just selling insurance, we're offering peace of mind. That's something that no algorithm on the internet or an online portal alone can do. It does require us as trusted advisors, agents making a real impact, and by to make that impact, give you the best tools in the industry. And we believe we have one of the best tools that you leverage going into enrollment to give your clients that better coverage, be a better agent, and earn more revenue in the process. Now, if there's any other questions, please let them come in. Otherwise, we'll make it happen here. And Kevin, do you have more questions that have come in?
Yeah, I'm doing my best to keep up with them.
Okay.
I know we wanted some HealthSherpa panelists to help, but I don't think we gave them the correct access. So
okay, so
almost done.
From that perspective, let's see here if we can't tackle some of these questions. Let's see here.
I think we have almost all of them answered. I think
We're all good to go.
yeah.
All right. Well, teamwork makes the dream work. So in that case, thank you all for joining us today to learn about the new integration and the new forming of a championship team with Allstate and HealthSherpa. Enjoy the rest of your day, and we look forward to seeing you soon. Thank you.